Every year in the U.S., thousands of babies tragically die suddenly and unexpectedly. SIDS is the leading cause of death among babies between 1 month and 1 year of age, mostly occurring when the baby is between 1 to 4 months of age. Other sleep-related causes of infant death, which are usually accidental, are suffocation, entrapment, and strangulation. So let's walk through some of the best practices for infant-safe sleep. There are preventative measures for pregnant women that can help reduce the risk of SIDS, including regular prenatal care checkups and avoiding smoking, drinking alcohol, using marijuana, and illegal drugs. Additionally, after your baby is born, do not allow smoking around your baby or in your baby's sleep environment. Room sharing reduces the risk for SIDS, but sharing a bed with your baby increases the risk for sleep-related deaths. We feel it's ideal for you to share your room with your baby for at least the first 6 months to a year. If you bring your baby into bed with you for feeding or comforting, make sure to return the baby to their own sleep area designed for infants on their back on a firm surface. When you and your baby go home, make sure to give your baby plenty of observed tummy time when they're awake to strengthen your baby's muscles. Now, many moms and moms-to-be may not know that babies who are breastfed are at lower risk for SIDS compared to babies who were never fed breast milk. According to research, the longer you exclusively breastfeed your baby, meaning not supplementing with formula or solid food, the lower his or her risk of SIDS. Babies need to be placed on their back to sleep for every sleep, including naps and at night. Starting out on their back is the most important for reducing SIDS risk. If the baby rolls over themselves, there's no need to reposition the baby. Babies need to be placed on a firm surface without blankets, pillows, and toys to ensure the safest sleep environment. Avoid letting your baby get too hot during sleep. Dress your baby in sleep clothing, such as a wearable blanket, designed to keep the baby warm without the need of loose blankets. Remember, if you are warm, your baby's warm.
Even though my wife was a kindergarten teacher and I'm a pediatrician, it happened to us, and it can happen to anyone.
You blame yourself. You go through what is and why. But
we know that there are things that you can do to lower your risk for SIDS deaths.
a baby must sleep alone. Always sleep on their back and always sleep in the crib.
ABC is a great way to remember it. The baby needs to be on their back.
Because when babies sleep on their side or on their belly, their face is up against the mattress or up against the pillow. And as a result, they can't breathe.
Family members, friends, neighbors. There's a community of people out there that can all help.
But I don't want to scare anybody. I just want to let people know it's very real.
Who wouldn't want to do something simple to save their baby's life?
I think if I could tell a new parent anything, it would be, I know it's hard. I've been in your shoes. But keep your baby safe. Put your baby alone on their back in a crib for every single sleep.